Good afternoon, everybody, and thank you so much for joining us today. We do apologize for some slight technical issues, but we're on the track of getting back going. Welcome to today's webinar, which is co-sponsored by the Regional Gun Violence Research Consortium at the Rockefeller Institute of Government, Johns Hopkins Center for Gun Violence Solution, and the Consortium for Risk-Based Firearm Policy. My name is Jaclyn Schildkraut, and I am the Executive Director of the Regional Gun Violence Research Consortium. As gun violence continues to impact communities across the U.S., researchers and policymakers continue working together to better understand the causes and correlations of this public health emergency. One of the newer areas of consideration is the intersection between alcohol misuse and gun violence. I'm very excited today to welcome our esteemed panel of experts to discuss this topic further. We do have one individual who is experiencing some technical difficulties, and I'm going to still go ahead and introduce him in hopes that we can get him on the line. First is Josh Horwitz, who is the Dana Feitler Professor of Practice in the Gun Violence Prevention and Advocacy at the Johns Hopkins Bloomberg School of Public Health, and also the co-director of the Johns Hopkins Center for Gun Violence Solutions. He works to reduce gun violence by utilizing public health research and health equity analysis to build advocacy campaigns that meet critical opportunities in the policy development process. With over 30 years of experience, Josh is a key leader in firearm policy development and education and has testified before numerous state legislatures as well as the U.S. Congress. Silvia Villarreal is the Director of Research Translation at the Johns Hopkins Bloomberg School of Public Health Center for Gun Violence Solution, and she's also the Managing Director for the Consortium for Risk-Based Firearm Policy, where she coordinates a group of experts to craft gun violence policy solutions from a public health perspective. Silvia aims to bridge the gap between research and policy by translating research into evidence-based reports. She has led the development of several such reports on firearm policy, including one titled Racial Equity Impact Assessment Framework for Gun Violence Prevention, and another called Alcohol Misuse and Gun Violence, an Evidence-Based Approach for State Policy with Josh that we will be discussing today. And our third panelist, again, we're hoping to get him on the line, is Senator Cory McCray, who is the Senator of Maryland's 45th Legislative District, covering parts of East and Northwest Baltimore, which is a seat that he won in 2018. His approach to public service is rooted in a profound commitment to hearing the concerns of his constituents and finding practical solutions. During his tenure in the legislature, Senator McCray has spearheaded the passage of over 60 bill proposals with broad subjects such as raising the minimum wage, transportation funding, protecting the environment, increasing SNAP benefits for families, and greater access to public libraries. It does look like Senator McCray will not be able to join us, but we will certainly work to get him into a future webinar and are extremely upset that he cannot join us today because we know his perspective is incredibly valuable. So with that, thank you, Josh and Silvia, both for joining us today. Very excited to talk about the work that you guys have been doing in this space. So I'd like to open it up by asking you, what is it that we know about the relationship between gun violence and alcohol use? In other words, why is this an important intersection to examine? Josh, I'll start with you.
Well, can I take a little, I think it's a very important intersection to examine. And I think it's something that I sort of feel remiss that I didn't do for, I've been involved in this for a long time. And I feel remiss that I didn't take a harder look at this earlier in my career, because it turns out that it's an incredibly important intersection here. And I'll just say that it's an intersection because nearly 1/3 of all homicides involve heavy drinking, and about 1/4 of all gun suicides involve heavy drinking. And when you think about interventions and risk factors, which I do all the time, this is one of the biggest risk factors that we have, and yet we are not deeply involved in that. And if Jaclyn, if you don't mind, I'd like to back up 1 second, just say, I think it wasn't until we started delving into the extreme risk protection orders or red flag laws. We started developing this about 10 years ago, and we started looking at their criteria, and it became so clear that alcohol abuse was such a driving factor here, that it's something that we really delved into and really wanted to really understand. And I think we're just starting to really fully get it right now. But I'll let Silvia get into a number of the details from our own report. But the thing that I think is important is you cannot deal with gun violence prevention without thinking about the role of alcohol, because it has such an outside influence as a risk factor.
Thank you for that perspective. Silvia, what are your thoughts about why it's important to study this?
Well, I could talk for 5 hours about why it's important to study this, but if I could just say it in one sentence, I would say that is because there is clear evidence that shows that alcohol misuse is a risk factor for gun violence, but we don't really see that connection often. We don't see it in media, we don't see it often in the research community, and we don't see it certainly in policies. So when we were writing a report about alcohol misuse as a risk factor for gun violence, I think it was last year, we were living through the COVID-19 pandemic for a few years. I don't want to say we were at the end of it, because like what really is that? But we started to see some really alarming trends. So in terms of gun violence, which is what we work day to day, we saw that gun sales increased by 40%. And a lot of those numbers were for first-time gun owners. We saw that, as Josh mentioned, gun homicides grew by 35%, and gun suicides had the largest one-year increase that was ever recorded. And at the same time, in alcohol, we saw that excessive drinking increased by 21%, and that alcohol-related deaths increased by 25%. So these numbers were so alarming to us that we realized that when we were talking about gun violence, we needed to consider the factor of alcohol as well. And even though this connection, this intersection is not often recognized, there is enough research evidence that points that alcohol misuse is a strong risk factor for gun violence. So really, when you ask me the question, why is this an important intersection to examine, it's because we know already that each year millions of violent crimes are committed in which the person, the victims, perceives the offender to be under the influence of alcohol. And because there's more than enough research that shows that the effects of alcohol, the disinhibition and the diminished cognitive capacity that it causes, increases the risk of violence in multiple ways. So it can lead to violent and aggressive behavior. And that is really how alcohol misuse becomes a risk factor for all forms of gun violence. And some of the most important evidence, just to bring the receipts to the conversation, we know that as many as 34% of firearm homicide perpetrators and 30% of firearm homicide victims and 25% of firearm suicide victims engaged in alcohol use prior to that. So that's really a third of the total numbers, and a third is a lot. So there were, when we were building this report, when we were trying to analyze this connection, there were a couple of fantastic studies that we found by our colleagues in UC Davis that show very specific risk factors related to alcohol misuse. And one of them is engaging in risky gun behavior, engaging in interpersonal firearm violence, but also dying by suicide. And if I can expand a little bit more, I know I'm already talking a lot, but it's important to think about this, because when you think, what does this information say? What is this information telling us? Why is it important? It's obvious to me, but because there is more than enough evidence that shows that alcohol and guns do not mix. So alcohol misuse is associated with dangerous gun behaviors like making threats with a gun, leaving firearms accessible to children, and it demonstrates that alcohol misuse, as documented from an alcohol related offense is a risk factor for interpersonal and self-directed violence. And this is going to become very important because one of the main recommendations that we are doing in the report is related to DUI. But before we go into like all of the evidence that we have in our recommendations, I really do want to point out that the research does not establish like a causal link. There's no cause and effect. But this is really a strong factor. And while all of this data, all the situation, what we were living through the pandemic, the numbers, the combination were very concerning, and it was like very, very alarming to find those trends. The good news is that there are clear policy options that can be implemented. There's evidence that some of these policy options that we're recommending, or I will get to it in a minute, work. So, for example, firearm laws can be designed to prevent individuals who misuse alcohol from purchasing or possessing or carrying firearms. But there are also other policies that are not specifically related to firearms, because when you're considering a public health approach, you have to also look at the environment. And some of those policies are looking at alcohol outlet density or limiting the hours and days of sale.
So much great information, Silvia. Thank you so much. I do want to come back to something because you mentioned some staggering numbers with regard to firearm homicide, firearm suicide, and firearm victimization overall. And I think it's really important that we acknowledge that gun violence does not impact all communities equitably or all groups equitably. What do we know about the disparate impacts of alcohol use relative to gun violence in different communities? I'll pose that to either of you.
I can get us started, Josh. So yeah, that is really a great question, and I'm really glad that you asked it, because when we were thinking generally about racial equity in our report and how we framed our data and our policy recommendations, we were considering all the disproportionate impacts of this intersection. And just looking at the numbers, we found that alcohol consumption, the same as gun ownership and gun violence, is very different, but by race. And what's not so surprising here is that alcohol consumption was most common among white people, and gun ownership is most common among adult white males. But, and this is a big but, it is people of color and their communities, the ones that are disproportionately impacted by the many, many outcomes of alcohol misuse and interpersonal gun violence. So we know from the data that Black and Latino men are more likely to report the dependence symptoms of alcohol consumption, but also the negative social consequences of drinking. And this is even when the rates of alcohol dependence and abuse are the same, or even they are greater among white male. And this is what is called the alcohol harm paradox. And it just explains that while groups that have been historically marginalized consume less alcohol, they experience more alcohol-related problems. And as I said, while alcohol consumption is most prevalent among white people, it is African Americans who were 2 times more likely, and Latinos 3 times more likely to report alcohol dependence. So that's really something to consider at the time of analyzing this issue. And you might ask me, but why is that, Silvia? Like, why is this happening? And so there are many reasons, and this is a multifactorial issue. But if I can say something in short, I would say that is structural racism and discrimination. One of the 2 important things to consider here, because they increase the harms of alcohol misuse and gun violence, and they exacerbate the racial disparities that are currently existing. And this follows exactly the same pattern as the disproportionate impacts of gun violence, unfortunately. So what we did here with our report, just looking at this disproportionate impacts, is analyze our policies, have our policies of limiting access to firearms for those that misuse alcohol, and limiting the access to firearms when and where alcohol is consumed. And we did a racial equity impact assessment. And what this is a tool that we created with the consortium at Johns Hopkins, and it was co-authored by other 7 great organizations, just to analyze and intentionally think about the disparities while also considering the risk of not implementing any policies. Like, what's going to happen if we don't do anything? What's the risk of inaction? So when we were doing our racial equity impact analysis, and we were working with the painful reality that people of color are stopped by police, they are arrested, they are denied bail, convicted, and sentences at higher rates than their white counterparts. And we acknowledge, for example, just going back to the DUIs that I was mentioning before, that limiting access to firearms for people with record of DUIs, which is one of our policy recommendations, could potentially lead to racial disparities. So one way to mitigate that is making recommendations within our REIAs, as we tell them, but they are racial equity impact assessments. So what we're recommending is to include clear language and clear criteria for enforcing these traffic stops, these checkpoints, having clear levels of alcohol for arrests, or protocols for enforcing the traffic stops. And this is where it gets tricky with racial equity, is that it's the implementation part that you need to pay attention to. So it's collecting this data about implementation, about this traffic stops, this field sobriety tests, and alcohol-related traffic accidents, the data that will help us monitor racial disparities and evaluate how these policies are implemented. And last thing, because I've talked about a lot of unfortunate truths today, there's also a flip side, and we need to talk about the potential protective factors of implementing these policies to address the intersection of alcohol and guns. So if we think about the data and what I was talking about earlier, where 1/3 of homicide perpetrators and homicide victims drank heavily before their death, if we just take guns out of the picture, we are taking the lethality out of the picture. So more often than not, these assaults are on women. So the policies that address this intersection of alcohol misuse and firearms can become the protective factors for people who are victims of domestic violence.
So I would just jump in there, and we were fortunate, Silvia and I were fortunate to be on a panel with Senator McRae last Wednesday. So I'll just jump in and a little bit of some of the things he was mentioning, but his district is the 45th Senate District in Maryland, which is East Baltimore, which happens to be where the Bloomberg School of Public Health resides. So we see this directly. His work is on alcohol density. And from an equity perspective, one of the reasons his work is actually reducing, I'm sorry, not density, but hours of operation. And so in his neighborhood, a lot of the liquor stores are open from 6 a.m. to 2 a.m. So they're only closed for 4 hours a day. And his idea was, from an equity perspective, this neighborhood is being devastated by alcohol. Can we reduce the hours of the off-sale site of sale of alcohol and reduce death. And that's exactly, so he was able to get that through the Senate and was able to actually some really promising research coming from the Alcohol Research Group, Pamela Trangenstein and Erica Rosen, looking at what that means for those neighborhoods. And from an equity perspective, you're seeing less African Americans being killed in those neighborhoods when the hours of alcohol sales gets reduced. So there's definitely other side of that, obviously, is that these are businesses, right, who are bringing some money into the community. So you have to weigh these things. But when you're talking about life and death, if you can reduce deaths by reducing sales of alcohol, I think we can weigh that in favor of saying, like, alcohol is still available. It's just not available from 6 a.m. to 2 a.m. And it seems to making a big impact on the community. And I think from his perspective, looking at his own community, from an equity perspective, stopping homicide in his community was his top priority. So I think you have to weigh when you weigh the equities, obviously we're always concerned about incarceration and carceral state. We also have to be concerned about life saved. And I think the reason we like these policies, that we're all the suite of policies we're talking about on alcohol, is because they work. They save lives.
Thank you for sharing that. It definitely sounds like there's some promising light ahead, thinking about the work that Senator McCray is doing. Josh, I want to ask you, obviously you talked, and both you and Silvia talked a little bit about some of the policies that you have recommended in this report, which for our audience is linked in your chat section. But I just wanted to ask, broadly speaking, what does the legislative landscape look like related to alcohol-related firearm laws?
Well, it's still in its infancy, so it's difficult. I think an interesting thing about the two sort of, we're thinking there's an alcohol kind of movement that seeks to reduce consumption and use of alcohol. There's a gun violence prevention movement, and I don't know that there's a lot of cross-pollinization. And I think there should be, because I think the state right now of alcohol-related gun policy is quite difficult, right? Some of these laws, like for instance, preventing people with 2 DUIs from having a firearm for 5 years, or like Senator McCray is limiting the hours of sale, they're not particularly popular right now, right? People want to address these harms, but they don't even know about the solutions. They certainly don't know about the evidence. So I feel like in many ways, it's where we were with things like extreme risk laws or firearm licensing laws 10 or 15 years ago, right? And that the policy landscape, people don't know about this. And also, you think about guns being often used to be, not anymore, the third rail of politics, right? That's not true. And we're passing gun laws all over the country. I don't think we've got there yet on either alcohol laws in general or alcohol firearm laws. And I think that's a shame, because there's some really strong promise here, but we need to start socializing these. We need to start educating legislators. We're still, when you think about the sort of the way I look at gun laws, I look at critical opportunities, and like, one of the most important things is that people support these laws. There's a big public health issue, but the solutions are well known, right? So that when you see something happens, oh yeah, I understand where we would want to put that solution. We're not there yet with these alcohol-related firearms laws. There's not enough awareness. So we are early in the advocacy stage. Like, when you look at the process, people need to know about these, and you need to start seeing poll numbers move. Like, oh, I understand that alcohol in the alcohol firearms mix is dangerous and needs to be addressed. And as far as I can tell, and I'm not an expert, I'm learning more and more about this, but the alcohol sort of policy movement is behind where we are in the gun violence prevention space. And part of that is, a lot, Silvia's, we talk about this all the time, about 50% of Americans actually drink it, in the last 30 days, haven't had a drink in the last 30 days, including me, right? So it's like, how do you take that, I drink a glass of wine at dinner or whatever, and then turn that into policy? Well, I think it's important. We're not talking about a glass of wine at dinner. We're not talking about enjoying a beer during the ball game. We're talking about alcohol abuse, and the intersection of alcohol abuse and firearms. That's a deadly combination, and we need a lot more education about that deadly combination, and then we can really get deeper into the policymaking process.
Yeah, that's a really important consideration. I wonder, just to kind of throw this out there, we obviously hear a lot of folks talking about the dangers of gun violence, and then also folks talk, we've been hearing for years about the dangers of alcohol abuse and misuse. And Josh, you mentioned the cross-pollination. How do we kind of get that messaging out? How do we help people understand that intersection better?
Number one thing, when I've got so many interviews over the last couple of years. Well, what happened during the pandemic? Why is gun violence on the rise? And we talk about lack of trust in law enforcement and lack of social support and more gun sales. What we don't talk about, and the media has no idea, is the rise in alcohol sales. So we don't talk about that, and people, very seasoned reporters that I work with, have no idea about that intersection, which tells me that's a job we have to do. We have to do that much better. For people who are listening, for our colleagues, there's a ton of easy to report information in the new report that we just did, and we need to use that when we're doing public discussions, talking to the media. You can't ignore a risk factor that affects 30% of homicides, and when we see the homicide rate rise, and there's some. We'll see. I mean, obviously, there's some indication that some firearm homicide is on decreasing. We don't have anywhere near final CDC numbers or comprehensive data, so we're still looking at that. But it'll be interesting to watch the alcohol and the gun pattern over the next couple of years and see if we can learn more about that. That's something that obviously our center is going to be looking at. So yeah, I mean, I think it's one of those things that we just need a lot more public awareness. And actually, frankly, we need a lot more attitudinal research as well.
Thank you for that. Silvia, I want to ask, why do you think that states should consider limiting access to firearms in places where alcohol is consumed?
So that was our main recommendation, our number one policy recommendation that came out of the report. And it really took a lot of discussion and consideration and coming to a consensus with a lot of experts from different fields to carefully think about how can we limit access? Like how do you make this a reality? Like what is it? What does it mean? So first of all, because not every state has this laws that prohibit firearms to people with a record of alcohol misuse, even if there's enough evidence that shows that it is a predictor of future crime. So the most, one simple action, the most basic, is to enact laws to prohibit the purchase and possession of firearms by persons convicted of 2 or more DUIs. And this is something that Josh already mentioned. And the reason why we placed this as our first recommendation is that we found that a person that is arrested for a DUI has already driven while intoxicated 80 times before they are arrested. So think about all the risk of driving 80 times intoxicated before you get your first DUIs. And also that 90% of the people that are already arrested for 2 DUIs already meet the clinical definition of alcohol abuse or dependence. So this is a very specific target group that we can reach. And the challenge with this specific option is how do you implement this policy? Like how do you enforce it? And as Josh mentioned, some states already have these laws. So what we realized when we were doing our legal analysis is that more often than not, some of these states that already have something related to these laws do not include clear definitions of who is disqualified. So that makes enforcing and implementation very, very difficult. So our recommendation is creating a clear standard that prohibits individuals that are convicted of 2 DUIs within a 5-year period from possessing or purchasing a firearm from at least 5 years. So that is one option. I think that has a lot of evidence behind it. But we have other options to try to look at this issue more holistically. So we're also recommending that states enact laws that prohibit the issuances of a license to carry a concealed firearm, and this is for persons who are convicted of one DUI or other records that point to alcohol misuse, and that could be like public intoxication or a conviction or receiving involuntary treatment for alcohol misuse, because precisely we already know that there is enough evidence that points that alcohol dependence and a very good way to measure this alcohol dependence in terms of firearm laws are DUIs. So our third option for states is that states need to make sure that these offenses that are related to alcohol that are firearm prohibitory under state or federal law are entered into the NICS in a timely manner. And Josh knows a lot about NICS, but what I can tell you is that it is a federal background check system that licensed gun dealers use at the point of sale to verify that the purchaser is not prohibiting from purchasing or possessing a gun. And the way it works is that the system relies mostly on input from the states. So states submit the names of individuals that are prohibited and into the system. And unfortunately, this reporting by states is voluntary, and many states do not report complete records into NICS. And if they do report them, then they do not update them in a timely manner. So this looking at this very specific option was really important for us, because what this database does is it helps to ensure that firearms are not sold or transferred to prohibited individuals. So it is really important to make sure that the quality and the completeness of this NICS database is accurate, because it really depends on the information that is submitted by the states. I have more options if I can keep going. Another option is when we're looking at this issue holistically, is that states need to provide funding to educate judges and courts to be able to help them understand the intersection of alcohol-related convictions and gun violence. So some options to think about here are, for education, are judicial conferences or bench cards or bench books or magazines or things related, education opportunities related to state bar associations. So what we thought it was really important with this option is to provide different types of education programs for the different people involved in the process. This so that they can provide all the people who work in the different front lines with information that they need to do the work. And our last recommendation, I promise this is the last option, is for courts to consider alcohol misuse as a factor in determining whether to issue civil restraining orders that are gun prohibitory. So we realize this is something that does not always happen. So when judges are doing their work, they need to evaluate all the relevant known risk factors that an individual may pose. So this association, this intersection of alcohol misuse and firearm violence is and should be part of any assessment of an individual's risk of gun violence.
And maybe I could jump in with a real example on that. So for instance, some states it's optional on a temporary domestic violence protection order whether the judge has the ability but not mandatory to remove a firearm during the temporary phase. So for instance, the evidence about alcohol abuse could, a judge should consider that potentially when thinking about, should I order firearm removal at the temporary phase of a domestic violence protection order, just to put that into context about what we're talking about.
So it sounds like, in your research and putting this all together and the other studies that have been done, that there's a lot of, at least a lot of starting evidence, if you will, that these interventions could help to reduce gun violence. Josh, I want to ask you, why don't we hear more about them from gun violence prevention groups?
Like I said, I started with this and it's a little embarrassing actually, that I've been involved with this for 35 years and I've sort of only got, kind of, up to speed in the last, certainly not like in the last decade, but really leaned into it the last couple of years. And I think it's because alcohol is it's very ubiquitous in society. And, if we do a GVP happy hour or whatever, people are, go to a bar or whatever it is, right? And we're not trying to stop that, but I think it's been so socially accepted that we don't take a step back and say, wait a minute, are we, what are the aspects here that are really harming society, but most importantly, impacting gun violence? And how do we sort of take the ubiquitous of alcohol away and say, wait a minute, there's things that we can do here to save lives, just like we're doing in so many other fields. And, it took the movement a long time to really lean in hard on community violence intervention. I predict this is the next sort of one of the pieces that we need to lean in hard on, because, when you think about community violence, when you think about homicide, suicide, alcohol plays such an outside role that we have to look at our own movement, and we have to really have a little bit of a reckoning in saying, why are we afraid to talk about this, right? We wouldn't be afraid to talk about other risk factors. Part of it is education, and part of it is sort of just social norming. And we have to be able to change that social norm that says alcohol and gun violence are highly interrelated, and we need to put that on the table. And when we talk to legislators, we talk to media, we talk to our communities, we have to put this on the table. It has to be there. And as Silvia said, there's a lot of policies to go through, including factors around the environment, like zoning and hours and taxation. There's many ways to get at this, but get at it some way, because you're not going to be able to fully address the firearms violence without addressing alcohol.
That's a great point. I do want to ask a follow-up, and you kind of touched upon this a little bit earlier, but you mentioned that we don't have a lot of attitudinal studies yet, right? We don't know a lot of things about how the public supports or feels about, this type of policy. But do we know anything, does the public support, any of these interventions? Are you guys hearing anything or seeing any research to kind of give us some insight about how the public feels on this?
Well, some of the research, I've done some research on this and not nearly, I've reviewed some of the research on this. And I can tell you that that from what I've seen, and there's just a lot more that needs to be done. When you compare policies that are clearly focused on firearms, and then you look at where sort of intervention around alcohol is, there's much more support for firearm prevention types of policies right now. And I think we need to sort of reflect on why that is. But the bottom line is we just need better data. It isn't studied the same way gun violence is. When you think about anytime news organizations want to make wave, they ask questions about gun violence prevention, and you can see it all the time in the elections, right? This candidate supports this, and this stand on guns hurts or helps. It's like ubiquitous. When was the last time you saw something about the role of alcohol in that manner, right? It's just not done. So it's the information we have is so much thinner that I'm almost hesitant to say it's, alcohol's here, firearms here, whatever. We just don't have that same type of piece. We're not even what I can tell, the data about, consumption is not even that clear, right? And so I just think there's a lot more to do. When you're thinking about advocacy, you definitely want to know where you start, right? Like, how many people would support this policy? Or how many people even know about this policy? When we started with extreme risk laws or red flag laws, it's the same thing. People didn't know about it. So when we said, do you support them? They're like, what? But now they know, and now they support them. And now we have laws in 21 states and the District of Columbia. So the starting point, and when you think about public health, oftentimes we think about public health education campaigns is rough, right? Public health education campaigns, think about smoking without the regulatory aspects of it, Think about seatbelts without the regulatory aspects of it. It's very hard to do those things. However, to get the regulatory aspects of those things, you need a certain level of baseline knowledge, okay? And that's kind of where we are in the advocacy space. We are getting people up to speed. And the reason that we wrote that Hopkins, our center, combined with the Consortium for Risk-Based Firearm Policy, put this report out, is to get the baseline out there, to do the very basics about, hey, wake up. This is a very big risk factor that we're not talking about, and you must. Like I'm a believer that when you're talking, when people are talking about risk factors for gun violence, it is, and you think about root causes. This is one of those. This is one of those. And the interesting thing is, it's actually one of those that we can make inroads on. We've seen some very persuasive data that we can make some inroads. Let's do it, because the gun violence prevention movement cares about saving lives. Well, if we care about saving lives, we've got to do that baseline education, even if we're not necessarily fully comfortable with it yet. We'll get comfortable, but you've got to do it, because this is a risk factor that cannot be ignored.
One thing that stands out to me, I'm kind of thinking about what Silvia, you said about, the intersection with domestic homicides or intimate partner homicides. One of the things we haven't talked about is mass shootings. And the reason I bring that up is, of course, that's my research area. But we know that typically when the media do quote statistics about mass shootings, they're using the gun violence archive data. And if you really dive into that data, it's not 600 and something events a year that are like your Columbines and your Sandy Hooks and your Auroras and your Uvaldes. Oftentimes it's, people are at a bar where alcohol is present and a fight escalates and a firearm is also present. So it seems that, really addressing this broader issue is going to be cross-cutting across many different types or forms of gun violence. I do want to ask, we obviously know in the gun violence movement or gun violence prevention movement rather, that there is obviously folks who support regulations and those who oppose it. What do we know about the landscape of organizations that are in opposition to regulating alcohol? Do we know anything about that?
Yeah, we do. And it's pretty amazing. I just did some quick, I've been looking at this and thinking about it for a while, but when you look at open secrets, which is looking at sort of the regulated spending part of the equation, there's lots of unregulated spending we know right now, but the total for beer, wine, and liquor is almost $30 million of lobbying, and the total for the gun lobby is about $3 million. Now, that doesn't account for tens of millions of dollars in C4 money and all that kind of stuff. But just as a comparison, it's interesting. And the alcohol lobby is spending a ton of money on regulatory affairs. And some of that is to stop these types of activities. So when you think about who are these people, Anheuser-Busch and InBev, right, is spending $5 million a year on just unregulated side of the lobbying tree, right? The Distilled Spirits Council, the Beer Institute, other private companies. I mean, we're used to going up against the NRA and the firearm industry and thinking, wow, those are big players. They're nothing compared to the alcohol industry. The alcohol industry spends they are putting huge amounts of money into this, and forget about, we know that the NRA spends a lot in money on their C4. That's not the same as their PAC, and it's hard to really figure out all the money that goes into campaigns and for all the things that go ahead with Citizens United. But that being said, from a regulatory perspective, the alcohol industry is spending a ton of money, even by Washington standards.
How do you think that that's going to be, and this is a question for both of you, what challenge? We know, of course, that the gun lobby was very successful in stunting the research on gun violence for quite some time. Do you see that opposition may also impact the ability for you guys to conduct the research, or others to conduct the research to really understand this dangerous intersection?
I mean, it's something that I worry about. I mean, but I think there is a difference, and that I do think that gun rights organizations, for instance, are well organized at the local levels for sure. The National Rifle Association has really fallen off recently, but the local organizations are pretty well organized, and they really show up and things like that. I don't know enough about sort of the alcohol grassroots, but I'm going to take an educated guess that they're not nearly as well organized.
So as we're nearing, our time, I kind of want to open up to you guys for final thoughts and also ask you, where do we go from here? What are our next steps, and how do we continue to not only understand, but try to counteract this dangerous intersection, that we're seeing between alcohol and gun violence? Silvia, I'll open up to you.
Yeah, well, I hope that this data, this information, these policy recommendations were as eye-opening for the people that are joining us today as it was for us. And these policy recommendations that address these intersections have the potential to save lives, as Josh was saying. Like, the goal here is to save lives. And we do acknowledge that there's a lot of work to be done, and there are still many research gaps and many policy gaps, but we need to bring all this homework to the gun violence agenda. We need to bring all this homework to the public health space. So what we're hoping happens now is that we can open up the conversation among researchers to study more this dangerous intersection and how it affects people differently, because that's the big issue here, that it disproportionately affects communities of colors, even if it's white people doing most of the drinking and alcohol abuse and gun ownership. So we also hope that this evidence can become a resource for policymakers to just better understand why alcohol misuse is such an important risk factor for gun violence, and that they become interested in addressing these gaps with our policy. Because one thing is just like knowing that this exists, and like the other is actually doing something about it. And for people in general, we just hope that we can begin to recognize that there are risks, like real risks that are associated with alcohol misuse and guns, so they can push for legislation. So as Josh was saying, like, there's not a lot of awareness now, and that's why there's not a lot of polls or like support for this intersection. But if you think about it, that's exactly what happened like in the 80s, where with driving and drinking, like people were just like, why are you taking my freedom away to like drink and drive at the same time? So we need to create the awareness and the risks that are associated with this intersection, so people can push for this legislation, and we can, as a whole, keep our community safe.
Yeah, that's great. And I would just say, as I'm a professor of practice and advocacy, and advocacy is a space that I really want to lean in here on and better understand the sort of framework, groundwork, what's been done before on these laws. We were just with about 500 advocates last week, for really trying to understand what the movements have in common. I think we need to do a lot more cross-pollination here and understand there's a whole language that in alcohol policy that we're just starting to learn, right? And a whole approach to what's been going on, and where can we share approaches so that we don't have to take everything, everything that movement does. And I don't know that I would, but there are pieces that I think we can find that common ground. One of the important things, and Jackie, you do a consortium. Our group is a consortium for risk-based firearm policy. Finding the spot where the experts agree is the art, right? There's always things we don't agree on, but where do we find consensus? And on the things that are in this report, both in the main recommendations and the environmental recommendations, I hope we can find consensus, because we can do that, we can save lives. So once we find that consensus, building strong advocacy campaigns is very important. And that's, we're starting that. We're actually starting to introduce these bills around the country and learning where the pushback is. That's what you need to do before you're successful. But I do think really understanding the advocacy space, what it needs, what type of information, more public polling, more research, but more organizing around this issue, I think will save a lot of lives. And I think in the gun violence prevention movement, we've got a tremendous grassroots these days, right? We've got tremendous organizing capabilities all over the country, right? More infrastructure than, of course, when I started years ago, nothing. Now we have millions of advocates around the country. If we can just put these pieces together and bring some focus around these issues, we can definitely save lives lost to gun violence.
And I can't think of a better point to end on, because that's, certainly the goal, I think, and what's brought us all together in this conversation, and also the work that we're doing. I'd like to thank you both so much for joining us today and sharing your expertise, as well as the time that you've invested putting together this report so that we had something to talk about. We will be making that available to all of our attendees. Of course, we do want to thank Senator McCray. Unfortunately, he wasn't able to join us due to technical issues, but we do appreciate the work that he's doing in his community that is potentially going to become a model for other communities tackling this same issue across the country. I'd also like to thank our guests for joining us today to hear about this important conversation. We will have this webinar available on playback. It will be sent out through the Rockefeller Institute, and we'll also be following this up with a 5 takeaways blog in order to ensure that, the key points of today's conversation, which was incredibly rich and in-depth and just filled with lots of great information, is available for ready access. And the report that Silvia and Josh and their colleagues have worked so hard on will also be linked in that blog as well. Thank you again so much for joining us, and I hope that everybody has a wonderful day. Bye, guys.